Hi friends, so let's discuss something about how to read radiology for PG exams, or how to mark all the questions correct. So friends, believe me, radiology is one subject where you can mark maximum questions correct if you have a little approach towards clinics. If you see any radiology resident, the first year resident, whenever they will try to report the x-ray or whatever a patient, they don't even ask for the clinical history, they just try to report. But you ask a third year resident or a senior resident, first thing they will ask is what is the history. So this is the importance of evaluation, how one progress. So without history, radiology is nothing. So always have a clinical approach. This is the best time you have knowledge of all the subjects, and radiology I know is the most neglected subject during our undergraduate days. We are least exposed to radiology, and even radiology department people, they are very cool. Even in rotatory postings, most of the people go for radiology posting, in optional postings, because they don't bother, they give the sign and all. So that is okay. But nowadays radiology is something which is very, very important, very crucial for each and every subject, right folks? Whether you are marking the medicine question or a surgery question, if you have little idea about the relevant investigation, then you can definitely mark it in solve it in a better manner. Nowadays we are practicing evidence-based medicine, right folks? So evidence means what? Evidence is either pathology or imaging, right folks? So we need to know it very thoroughly, and just don't apply, just don't read the image, read the patient's history. So clinical history need to be collaborated with the imaging, right folks? Then only, not only you will be able to make a proper diagnosis, also you will be able to decide which investigation to go for, whether a contrast should be given, contrast should not be given, should we go for x-ray, should we go for USG, or a cross section is needed, CT is needed, or MR is needed. All these things, clinics, if you attend your clinics, and if you go through the clinical history thoroughly, you can mark most of the MCQs correct. And for any MCQ also, you need to know the keywords. If you know the keywords for that particular clinical situation or particular imaging, then 99.9% you will mark the questions correct. So the keyword is the answer for every answer, right folks? So always and always try to incorporate clinical things while solving the radiology question, or apply the radiological logic while solving the clinical MCQs. It will help you not only solving the radiology, other questions as well, and you can achieve success in a better manner. Thank you.